all about ass control. That's what it is. You've got to lean back, you control the amount of traction by how much you do a little hip hinge and lean your body forward and back. And you will see that as soon as you put the belt on. Forward. So, belt goes on like so. And then we're in the red. And Paul, what's your safe word?
Stop, it hurts.
Happy place is a bad safe word. It's a very ambiguous safe word. Oh, my hand, sorry. It's just a magic trick. So there we go. Paul disappears. So I'll shoot this video and I'll fuck me up. Here we go. So you got to get this hand, put it in on the iliac crest. You got to try and stabilize the iliac crest and use the hip to pull the hip. Can you put the flexion in the hip there? Right. So let's say our comparable side's going to be flexion, and Paul's getting a little bit of stiffness when we go here. This is just all going to go wrong for me now today. So we get to this part. Paul's getting a little bit of impingement there. So we apply our glide, and then we repeat the movement. Again, we glide on it.
You just hop in the head, laterally.
Yeah, and you're paying £6 grand for this shit. That's all I'm doing, hopping in there, and you're paying £6 grand for it. Well, you could have got this out of a book. Pretty much like so.
What are you, on the iliac crest or well?
Yeah, do you want to come around and have a look?
Yeah.
Instead of sitting in your chair here and just lying straight down.
Yeah.
What are you not doing?
Fair comment.
So, let's grab the iliac crest like that. And if you can get your hand in closer to minimise the lever. If I'm out here with this, is it going to take more effort for me to stabilise Paul, so it's more awkward. So if you get in there like that, you get used to that kind of tucked in position there, less effort, but a good bit of practice.
What's the difference between supporting the trochanter and the iliac crest?
Well, I'm trying to pull the trochanter out towards me, so if I'm pushing it back in at the same time, I'm using a lot of energy and nothing's happening. Apart from that, I'm trying to rip Paul's adductors off his thigh. That's all that will be happening then. So we're trying to get a little traction out like that. That's the deep. That's the flexion. Now, just a little tip, it's not quite like this in your book. For the external rotation one, I like to flip in like that so you can catch in around the leg that way there. And I can use my arm as a lever that way. The external rotation, so we get here. And I just rotate my body, so again. Okay, so in, and then we try and get some more external rotation.
What stage would you like to use that thing?
Huh?
What stage would you like to try the technique? Will be again depending on the scene? Will be in the cue?
Depending on the sin. Okay, so what, I suppose, we didn't cover this too much. What do we have to look out for in the hip? What's the ones that are going to be a bit scared of? OA I'm not too scared of, but late stage OA I'm scared of. Osteoporosis I'm scared of. Femoral neck fractures I'm scared of. You know, so basically you've got to screen actively for those things. And then if I'm happy enough, it's not something like that, it's a very low risk of that, then we can work away and try this stuff there. For the higher grade OAs, I'll show you them in a minute, they're very simple. You pretty did them in seconds, you do very simple long axis mobilizations for them, very simple. And just wait for them to, and do a lot of hip strengthening and wait for them to get a hip replacement basically, because it's a very successful type of operation, and it works very well. So, again, this is going to be your external rotation with a lateral glide. Internal rotation, if you wrap your arm around this way, you get internal rotation. Sorry, a little bit better. How you feeling there? Okay? Yeah. Now, if I go like this, tell me when you start to do a little pinchment there. Pretty stretchy. So you can check that as a comparable sign and see when they start to get that impingement. Then add your lateral glide and see if you can get a little more. Get the idea? Okay, that's that. Now what else do we have to do? Flexion, internal rotation. Oh yeah, and this quadrant type position here. So this kind of knee to shoulder, internal rotation, flexion type position there. You okay there? Yeah. Still not pinching there, no? That's them, pretty simple. So, for flexion, that way. For external rotation, that way. For internal rotation, that way. hand goes inside the belt. Stabilise on like that.
And it's always on the crest. It's always on the
Always
edge.
on the crest, yeah, because you're trying to stabilise the pelvis and pull the hip out, pull the femur out. Like that, so you're trying to create that gapping in the joint to localise your gapping force into the joint there, into the bone. So, is the idea?
Yep.
Makes sense. Lovely.